Good morning. I'm Daphne, working as nursing tutor in Emmanuel RSR College of Nursing, Natalam. Today we can see the cranial nerves. There are 12 cranial nerves that we can see in detail. So the name of cranial nerves are olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, and hypoglossal. These are the 12 cranial nerves. Let us see one by one. The first cranial nerve is olfactory nerve. So the component is sensory, its function is smell. Olfactory means smell. The origin is olfactory receptor nerve cells. Opening to the skull is openings in cribriform plate of ethmoid. Second cranial nerve is optic nerve. So this component is sensory. Its function is vision. Optic means vision. Origin is from back of the eyeball. Opening to the skull as optic canal. The third cranial nerve is oculomotor nerve. Oculomotor nerve. So this is the motor nerve. Okay. So oculomotor, the component is motor and its function is raises upper eyelid. They will raise the upper eyelid and turns eyeball upward, downward and medially. Medially means towards the inner side. Constricts the pupil. Accommodates the eye. Origin is anterior surface of the midbrain. Opening to the skull is superior orbital fissure. And fourth cranial nerve is trochlear nerve. Its component is motor, function assisting in turning eyeball downward as well as laterally to the side away from the nose area. Next is origin, that is posterior surface of the midbrain. Opening to the skull is superior orbital fissure. The fifth cranial nerve is trigeminal. Here it contains three nerves, that is ophthalmic, maxillary and as well as mandibular nerve. So ophthalmic nerve, its component is sensory, function cornea, skin of forehead, scalp, eyelids and nose, mucous membranes of paranasal sinuses as well as nasal cavity. Origin is anterior aspect of pons. Opening to the skull is superior orbital fissure. Maxillary nerve is sensory. Its function is skin of the face over maxilla, teeth of upper jaw, mucous membrane of the nose, the maxillary sinus and palate. Origin is anterior aspect of the pons. Opening to the skull is foramen ovale. Then mandible is motor. Muscles function is muscles of mastication, mylohyoid, anterior belly of digastric, tensor veli palatine, tensor tympani. Origin is from anterior aspect of the pons. Opening to the skull is foramen rotundum. Mandibular nerve is sensory. Function is skin of cheek, skin over mandible and side of head, teeth of lower jaw and teeth of middle jaw. Mucous membrane of mouth and anterior part of the tongue. Origin is from anterior aspect of the pons. Opening to the skull is foramen rotundum. Then sixth cranial nerve is the abducens nerve. Abducens nerve is motor and its function is lateral rectus muscle turns eyeball laterally as shown in the figure. So origin is from medulla oblongata. Opening to the skull is superior orbital fissure. Seventh cranial nerve is a facial nerve. This is mixed component. The function of this is motor as well as sensory. Muscles of scalp and face, stapedius muscle, posterior belly of digastric, stylohyoid muscles. In sensory, taste from anterior 2/3 of the tongue, from the floor of the mouth and palate. And its function in secretomotor is submandibular and sublingual salivary glands. Mandible means present below the lips. And lingual means present below, sublingual means present below the tongue. Okay, and origin is from medulla oblongata, opening to the skull is internal acoustic meatus, facial canal, and stylomastoid foramen. Eighth cranial nerve is the vestibulocochlear nerve. Vestibulocochlear nerve, its component is sensory. Function is vestibular sacculae and saccule semicircular canals. Position of head. Cochlear is organ of Carti, responsible for hearing. Origin is from medulla oblongata, opening to the skull is internal acoustic meatus. Glossopharyngeal nerve is the ninth cranial nerve, and it is mixed as well as mixed, that it contains motor, sensory as well as secretomotor. Glossopharyngeal nerve origin is from medulla oblongata and opening to the skull is jugular foramen. Vagus nerve is a 10th cranial nerve. It is motor. Its origin is from medulla oblongata. Opening to the skull is jugular foramen. Accessory nerve is a 11th cranial nerve. It is motor. Origin is from medulla oblongata. Opening to the skull is jugular foramen. Hypoglossal nerve is a 12th cranial nerve. Its component is motor. It arises from medulla oblongata, opening as hypoglossal canal. Thank you.